if you can please like and share this video, I am sure that you will find ample reason to do so. It will be informative and it will be educational on what's really going on with COVID-19 in America right now. I will talk a little bit about it from my own personal experience, having just a few days ago gotten out of COVID quarantine after not only I, but my entire immediate family and my sister's boyfriend caught the virus. Thankfully, none of us were hospitalized. We all persevered through it and are part of that statistic now that shows that so many people are getting through it, are surviving this virus, which, by the way, has an incredible range of symptoms. It's absolutely extraordinary. Today here on the show, we're going to be diving in deep for a little bit into what's going on with COVID-19, the situation with the vaccines, the public policy, a variety of things that we are going to be talking about today to make sure that you're getting accurate and as complete as we can information on what's really happening right now. And to talk about this, I am so pleased to have three physicians themselves joining me here on the show. Dr. Lewis Kohl is Chief Medical Information Officer, Senior Medical Director, and Chief Safety Officer at CareMount Medical. Dr. Lee Gross is the owner of Epiphany Health and president of Docs for Patient Care Foundation. And Dr. Nan Hayworth is former Congresswoman for New York's 19th Congressional District. She is, in fact, the first female doctor ever elected to serve an entire term in the United States House of Representatives, and is also a retired physician herself. All three of these doctors join me now here on Jimmy at the Crossroads with their expertise. Thank you all for coming on. I so appreciate the opportunity.
Come on, Jimmy, what you got?
All right, so I want to start off by going to Dr. Kohl. I want to talk to you for a moment about the nature of COVID-19 right now, Dr. Kohl, particularly given that we are seeing cases go up, but thankfully we have generally been seeing the mortality rate, it seems, kept in check. We are seeing some hospitalization increases in certain parts of the country. But from my experience with COVID-19, the symptoms are just absolutely varied. You have a range that goes from being asymptomatic to maybe having just sort of very mild flu-like symptoms to having maybe, like I felt, a nasty flu, congestion. I'm still getting over a little bit of the congestion, a cough, a couple of points where there were chills or basic body aches, to where you have an outright fever, could be a serious high fever, maybe even requiring medical attention. You can have oxygenation levels that get too low, could require hospitalization. You can have real strong physical body pains, but there is a real, I just found it to be a strange range, especially as my family went through it, and now a number of other people I know are currently enduring COVID-19. So Dr. Kohl, let's start with you. What is sort of the nature of this virus right now?
You know, it's an animal virus, so it jumped into humans. So really all bets are off. When a virus develops for millions of years in your species, its goal is not to kill you. Its goal is to reproduce and get to the next person, because evolutionarily, success is reproducing. This virus, because it jumped into humans from an animal, it's going to find its way with us. Like you said, it's been everything from completely asymptomatic, where you don't know you have it, and that's why it spread so fast, to family killers. I mean, in New York, we saw entire families wiped out. It depends on your genetics. It depends on your risk factors. New York had its early outbreak, so we are not seeing as many people hospitalized now or dying as we did. I think it burned through a lot of the vulnerable population, and hopefully people are a little bit smarter about protecting themselves right now. But like you said, this is a virus that we learn a little bit more about every day.
Yeah, and that's the thing, Dr. Gross, to Dr. Kohl's point. The thing that strikes me so much about this virus is that we knew very little about it in the beginning. Now we know much more, but it's still like you can't exactly predict, okay, this person is going to feel this way and have these particular symptoms. So what are your thoughts on where the virus is, what the nature of this virus is, and then also sort of the progression of the caseload, because we are seeing it tick up noticeably across the country?
I think that's the important thing is now we've experienced this virus for since March. And we're starting to get an understanding of the pattern of the behaviors and who really are the most vulnerable. And what we can see is that, 90+% of the deaths in the country are in the elderly. They're in the 65 plus population. So as you're looking to, sort of target who you're going to protect, that is definitely your most vulnerable populations. And as we're opening up schools across the country, we're actually seeing, kids certainly can get sick, but they just do not appear to be the super spreaders that we sort of feared. The Florida schools have been open since August, and we've just not seen, thankfully, mass outbreaks in the schools. I think that's probably in large part because of the great work the schools, the teachers have been doing in that. But, so in Florida, we're now seeing a large spike in the number of cases. I will point out that in the United States, we're now testing 1.2 million people per day in the country, 1.2 million tests per day. But, so as we hear the president saying, well, you're doing so many tests, but the percentage of positive tests coming back is also going up, which means the disease is absolutely definitely spreading. It's not just because we're testing more people, we are seeing more disease in our communities. But as you pointed out, here in Florida, we're now approaching, again, 5,000 cases per day, but the death rate in Florida has dropped to the lowest rate since July. And it continues to drop every single day. So as the numbers are rising, the death rates are in fact dropping. And the interesting thing is, as the hospitalization rates remain flat in Florida, we're still seeing drops in the deaths. And I think that's largely due to a few factors. Number one, as Dr. Kohl had mentioned, there was a vulnerable population that was hit very hard early in this process. It's affecting a younger population here, especially in Florida. We're getting better at identifying who really needs to be hospitalized and who can sort of stay home, what the risk factors are for that. And then the therapeutics are getting much better between the steroids and the remdesivir and the plasma treatments. I think that the opportunities to treat these people more aggressively, and as of just yesterday, the emergency use authorization now of outpatient therapeutics is very promising. So I think there are great opportunities moving forward.
Dr. Kohl, I would love for you to comment a little bit on what you have noticed, especially from the emergency medicine and urgent care side, about these trends in terms of the exposure to the virus, in terms of the number of infections, that is the rising positive caseload, but also the trend in hospitalizations and mortality rate, to what Dr. Gross was talking about.
Yeah, we are definitely experiencing in the New York City and Hudson Valley area of New York State, we are definitely seeing a very rapid rise in the number of people who are infected. We're also, as you said, testing many more people. We are not hospitalizing as many people as we did in March and April, and fewer people are dying. All good. We do see that those who are vulnerable have figured out they need to bunker down. We're definitely seeing it spreading very fast in the young, but a very significant portion of the cases are asymptomatic, where they say, I've just got a runny nose, I've got, it's my allergies, and you test them and they're positive, or just a sore throat. So we are definitely seeing that same sort of thing, but the problem is as it spreads, you're going to nail the more vulnerable population if they're not careful. We're definitely seeing, for Halloween, people went to parties. We're seeing athletic activities where everybody is outside without a mask. People, especially when they eat, they let their guard down. They say, well, I've got to eat, and you're 2 feet away from somebody who also doesn't have a mask on. You trust them, they're your family, or they're your good friend, and then next thing you know, you're under quarantine because they were positive. But we're definitely experiencing the same thing in New York, at least in our area, of declining mortality certainly compared to what we saw in the spring, and also hospitalizations.
Yeah, I can attest, being part of a family that ended up contracting it, all of us, that you certainly may get set in certain comfort levels in particular situations that could find it yourselves self-deceptive, shall we say. Dr. Nan Hayworth, I want to ask you, on your perspective, where we are at, especially based on the data that you have studied and gotten to understand, what we just heard from Drs. Kohl and Gross, but particularly also in terms of this public policy side, because some have said, oh, the lockdowns really worked before, and so that's why some places, I think Colorado's leaning towards returning to a lockdown, unfortunately. There's the mask mandates, these other things. Do you think that some of the public policy steps that have been taken across the country have been effective? What are you noticing overall?
Well, I'm so fascinated to hear of Dr. Kohl's and Dr. Gross's experiences on the ground in practice, caring for these patients on the front lines. I sit somewhat back of that, obviously, and survey the whole landscape. And certainly, if you look at the evidence, lockdowns don't seem to work, except perhaps in areas of intense urban concentration. But the overall data are such that even the World Health Organization has said that lockdowns should not be a primary tool. And one of the statistics that's of great concern is that probably now about a month ago, the Centers for Disease Control issued an analysis of all causes of death, excess deaths versus what would be expected for the course of the year during which we had this pandemic. And there were 300,000 excess deaths, of which 200,000 were attributable to COVID. But 100,000, fully a third of those deaths were not directly attributable to COVID, but were attributable to the effects of lockdowns. And that includes neglected medical care, people who did not go for care when they needed it, when they should have. It includes deaths of despair, depression, drug overdoses. It includes deferred diagnoses, and some cancers are so aggressive that we actually have had folks perish from cancers that were undiagnosed even in these few months. And reputable authorities have said that they expect that eventually the deaths from undiagnosed cancers will actually exceed those from COVID over the course of the next several years. And that's a dreadful toll. In terms of masks, they if they're worn in hospital, and I can't wait to hear Dr. Kohl's and Gross's experiences with this and their opinions, but certainly at the top line is that if they're worn hospital style, which the vast majority of people do not wear, meaning an N95 style mask worn in such a way that all of your breath passes in and out of the mask, nothing goes around. That's really a standard that very few people meet in their everyday lives. If you're not wearing a mask that way, the protective effect is reduced. There is probably a benefit at the margins, and that's enough, given that it's a minimal imposition, for, I think, most of us to say that it's not a big deal to ask me to wear a mask in public. But certainly, unfortunately, it's not a panacea and it's not a guarantee. Hand washing, I think, has had a major beneficial effect, and hand washing and surface disinfection in terms of the transmission of infectious diseases overall, especially viruses, the flu, the various forms of common cold, which include from rhinoviruses and adenoviruses and coronaviruses that aren't the novel coronavirus, and norovirus, which is the awful GI bug. Those, I think, have all decreased in incidence because we are paying a lot more attention to that kind of hygiene.
Yeah, one thing I have noticed is that if you are lucky enough to go into a restaurant, or like I do, I often go to my local Dunkin' Donuts and go sit in the coffee shop and work on my computer for however many hours. You go into the bathroom and you do notice that there, at least especially in the high points of this virus, that people are using the soap a lot more than they ever did before. Dr. Lewis Kohl, I'd love for you to talk a little bit to what Dr. Nan Hayworth was talking about there with regard to the masks and some of the other factors. But one of the things that she hit on that I thought was just so important are the negative effects of these lockdowns, the stressful situations from people who have lost their jobs, who found themselves in at-home situations where they're stuck at home a lot more, maybe more abusive. For example, child abuse also has been going up through the roof in so many parts of the country. And now you have kids that are back in remote learning and their adverse effects long-term in terms of education. What are your thoughts on some of the steps that have been taken and their efficacies, Dr. Kohl?
So let me go to masks first, because I really do think masks work. N95s are clearly more protective than a regular surgical mask or a thick cloth mask. But even in our own practice, we see 7,000 patients a day. Very few of my staff members, docs, nurses, medical assistants, have gotten sick. And it's because we made every patient put on a mask to walk in the practice, and we make our staff put on masks, and we make them wear eye protection. This particular virus is spread mostly by droplets. Droplets are little tiny balls of spit that you create when you cough and when you talk. And you're catching a lot of these if you have a mask on your face and the person you're talking to has a mask on their face. And I don't think this is a civil rights issue. I think you don't necessarily have a right to hurt somebody else. If you don't want to wear a mask in your house, by all means, don't wear it. But if you go out and you're potentially near someone who's vulnerable and you don't know that someone's vulnerable, they can look young and healthy, but they could have bad genetics or medical problems and they could still die from this. So I really do believe in masks. I think that if everyone wore masks, we probably wouldn't need to shut down. It wouldn't be necessary or necessary in every area and circumstance. It's absolutely true, and I think the data is growing, that having everyone trapped at home and even afraid to seek medical care certainly hurt people. We know in New York City there were a significant number of excess deaths, people who literally stayed home with heart attacks because they were afraid to go to the emergency department because they'd catch COVID. So yeah, you have to have a compromise. You have to be able to seek medical care, to seek socialization with other people, to get services that you need, but you need to do it in a safe way. And to me, that's masked.
Dr. Lee Gross, what are your thoughts listening to some of what's being said here, sir?
Yeah, I think the important thing is that a one-size-fits-all approach is just not appropriate. So wearing a mask in an emergency room makes a lot more sense than wearing a mask standing by yourself out in right field of the baseball field. And I think one of the issues that we had early on is, we shut down Bonita Springs, Florida, when there was an outbreak in Manhattan. That didn't make sense. It doesn't make sense to have so if you look specifically at Florida, about 60% of reporting jurisdictions in Florida have less than 100 cases since the whole start of this thing, and about 40% of the jurisdictions have less than 10 cases in their communities since the entire start. Why are we masking them? Why would we mask a community that doesn't really have disease unless there's particularly high-risk people? So, if the outbreak is in Miami, then we don't lock down Wauchula. We take appropriate precautions. We wash our hands. We protect the vulnerable, but we don't necessarily lock down the healthy. I think one of the important learning messages is that what's good for one community may not necessarily be good for all. And I understand that you have to take approaches. If we want to protect that community with 10 and keep it at 10, there are certainly some steps that can be taken to do so. But again, the same approaches in every community is not necessarily appropriate.
Dr. Nan Hayworth, to Dr. Gross's point about local communities or states handling things differently, we're now seeing increasingly Joe Biden, who may be the next president of the United States, talk about a national mask mandate and expanding on a number of things from a top-down level at the federal government. And I'm curious your thoughts on that sort of approach as opposed to the more state-by-state strategy that President Trump's administration has taken.
Well, you do run into distinct constitutional issues. That's just the way this country runs, Jimmy. A president cannot declare a national mask mandate any more than a president can declare a vaccine mandate or a national lockdown. That said, states have tremendous power to take those actions on behalf of public health, and indeed have. And it has definitely varied state by state. And to Dr. Kohl's point and to Dr. Gross's point, it's incumbent upon every state and every community to be vigilant, to be meticulous, to be thoughtful, and for their citizens to be aware of what their vulnerabilities may be and what they can do and what they can accept in their own lives as measures to try to reduce the impact of this virus. All of that said, it's very important for us to recognize that fortunately, very fortunately, the survival rate for this virus overall in the United States population is greater than 99%. To my very good friend and colleague, Dr. Kohl's point, however, he is right. We can't predict necessarily. We can figure out who's most vulnerable, but we can't necessarily predict who among the walking healthy may be struck down by this virus and have a terrible experience. Fortunately, though, as Dr. Gross pointed out, therapeutics are now speeding to market ever more efficiently and effectively. And we just had a new antibody, an intravenous antibody preparation that Lilly has created. It imitates the body's response to the virus. We all remember President Trump talked about receiving Regeneron, which is actually their antibody cocktail, REGN-CoV-2, and SARS-CoV-2, I think it's called. And that contain the antibodies that your body would ordinarily generate, but you don't have to wait to get sick to have the benefit of those antibodies. That's a tremendous therapeutic advance. That's going to become widely available at scale, I'm sure, very quickly. Regeneron is ready to produce their antibodies at scale. When they get their emergency use authorization, we have remdesivir, we have dexamethasone, we have procedures that we know will help people in the worst case scenarios. And all of those things together mean that we can feel more at ease about a given state opening up relatively more than perhaps some other state does. Florida is more open than New York, and Florida seems to have fared quite well, all things considered, in this crisis.
Again, we're talking with Dr. Nan Hayworth, former Congresswoman for the 19th Congressional District in New York, Dr. Louis Kohl, Chief Medical Information Officer, Senior Medical Director, and Chief Safety Officer at CareMount Medical in the state of New York. By the way, I'm originally from upstate New York, so you've got three original New Yorkers here on this program today. And then also Dr. Lee S. Gross, owner of Epiphany Health and president of Docs for Patient Care Foundation. He is in Florida. Just a few minutes left with the three of you, and I so appreciate the time. Dr. Kohl, I would love for you to please speak to what Dr. Hayworth was saying as far as some of the therapeutics. What are you noticing has been working? I know, for example, that I have seen lately in the past 3 weeks, I know more people, including myself, who've contracted COVID-19 than I had at any point, maybe even combining all the previous months. So I can definitely attest that positive cases are going up. But everybody I know, but for one person who has just in the past few weeks contracted this virus, thank God, has not been hospitalized. The friend of mine who has been hospitalized is currently or just wrapped up a remdesivir treatment. So that's certainly one that we know a lot of folks, including President Trump, have gotten as part of their treatment. So Dr. Kohl, what have you noticed has been working in that regard? And what's your take on the prospect for a vaccine, such as the one that Pfizer seems to be close to finalizing potentially, or at least is showing real progress?
So I think the first big step was definitely Decadron, which is an old drug, and it definitely seems to have reduced the number of folks who progress to going on ventilators and even die. The folks that we talked to in the ICUs around the city, many of them were using steroids before it became acknowledged that they were beneficial, because they were trying anything when in March we were seeing patients dropping like flies. So the steroids made a big impact on people not progressing to death and intubation. Remdesivir is helpful. It certainly is not like taking an antibiotic for strep. You take the antibiotic and you get better, but it is mildly effective and probably also prevents progression. The antibodies that Dr. Hayworth mentioned by Lilly and Regeneron, we are hopeful that those will be very effective. They're going to be expensive, and they can potentially have side effects anytime you take an antibody like that. your body can have a severe, what's called an anaphylactic reaction. Hopefully you won't with these, but not that many people have tried them yet. I think the expense and availability are going to be the bigger issues early on, but it's phenomenal to see them get to market so fast. I have very high hopes for the vaccines. My guess is we'll probably have 3 approved vaccines at least by January, maybe sooner. They've all in the early trials shown effectiveness in terms of getting your body to make an immune response. How long that response will last, we don't know yet. And we obviously don't have long-term safety data. We want to get as much safety data as we can, but probably the best way for us to get out of this is to get people vaccinated.
Dr. Lee Gross, what are you noticing as far as treatment, sir?
Yeah, so I just actually want to piggyback on what Dr. Kohl said really about vaccines, because I think that's a really critical point. Yeah, so we lost almost 300 children in 2018 to influenza, and we have a vaccine for that. 80% of the children that died that year did not take the flu vaccine. And so polling in the United States now around potential COVID vaccines said that about 70% of Americans are skeptical of the vaccine and will not take it. Only 30% in the public opinion polls say that they trust the vaccine. I want people to keep an open mind about this vaccine, because we are not rushing the science of the vaccine. What we are doing is rushing the infrastructure developments around distribution of this vaccine. We're creating vials, sterile vials. We're getting vaccine distribution plans. That is all part of the Operation Warp Speed. But the scientists that are developing these vaccines are largely staying out of the politics, and we really appreciate that. And I think these vaccines will come out. They will be safe. They will be effective. And I do think it is the solution to this problem for the American public.